Assalamu alaikum to everyone. Our today's topic is indicators of health, quality of life, physical quality of life index, and human development index. I am Dr. Hilal, demonstrator GM, community medicine GMC Srinagar. What is health? Health is defined as a complete state of physical, mental, and social well-being, and not merely an absence of disease or infirmity. Measurements have been framed in terms of illness, for example, morbidity, mortality, but the economic, occupation, and domestic factors too influence the health. Now, the health indicator. What is indicator? Health indicator is a variable that provides a single numerical measurement of an aspect of health within a population for a specific period of time, normally a year. Health indicators are used to measure health status of community. Indicators can be in rates, in ratios, in numbers, in a specific place and time. What are different indicators of health? The indicators of health are mortality indicators, morbidity indicators, disability rate, nutrition status indicators, healthcare delivery indicators, utilization rates, indicators of social and mental health, environmental indicators, socio-economic indicators, health policy indicators, and indicators of quality of life. What what are the different uses of these health indicators? The uses of these health indicators, they are used for the measurement of health of a community, to compare the health stats of one community with another, whether in the same continent or globally, or for proper allocation of human and non-human resources according to the needs of defined population. To compare the health stats of different areas or groups of a people over time. What should be the different characteristics of these indicators? These indicators, they should be valid. That is, they should actually measure what they are intended to measure. They should be reliable. They should give similar results when the measure is used for the same person but in different conditions. Objective doesn't depend on subjective feelings of a person. Relevant should contribute to the understanding of phenomenon of interest. Specific, they should only reflect the changes in the measured condition. They should be sensitive to the change in the measured condition. Now the population growth rate. What is population growth rate? It's a growth of a population size in 1 year expressed in percent. It is total fertility rate. It's the number of children that would be born per woman if she were to live to the end of the childbearing years and bear children at each age in accordance with the prevailing age specific fertility rates. What is life expectancy at birth? The number of years a newborn baby would live if subjected to present mortality risks prevailing for each age group in the population. Very good indicator of socio-economic development of country, of an area, of a place. So positive health indicator of long-term survival. Life expectancy at birth in India in 2017 it was 79, where males live lesser than females. Crude birth rate. This crude birth is defined as number of births per thousand population during 1 year. CBR in India is 20 per thousand population. CBR is a depend on age structure of population. That is, a population with a large proportion in the childbearing age naturally has a higher crude birth rate than a population with predominance of either children or a people beyond fertile ages. The high crude birth rate in India arises from the combination of high fertility and a young age structure. What are the different mortality indicators? For example, crude death rate is the number of deaths per thousand population during 1 year. There is a crude death rate for India is 6.2 per thousand population live per thousand population according to the 2018 Health Bulletin. So the many of the European and Central Asian countries like Sweden, Switzerland, Germany, they had a crude death rate higher than crude birth rate, causing a negative population growth. Infant mortality rate, the annual number of children less than 1 year of age who die per thousand live births. An important indicator of health status of not only infants but also whole population and socio-economic conditions of the population. That sensitive indicator of availability, utilization, and effectiveness of healthcare, particularly perinatal care. Current IMR in India is 32 per thousand live births, as per 2018 SRS bulletin. Most common causes of IMR in India is due to pneumonia, diarrhea, and congenital malformations. Childhood mortality, that is infant mortality. As we have already discussed, a number of deaths of infants up to 1 year of age or younger per thousand live births. As a perinatal mortality, the total number of deaths of fetus from a gestation age of 28 weeks to the 70th day of life of the newborn. Neonatal mortality includes deaths in the first 28 days of life. Postnatal deaths, that includes deaths after 28 days of life but before 1 year. Now the under 5 mortality rate. It's a number, the annual number of children dying between birth and exactly 5 years of age per 1000 live births. It correlates with inadequate MCH services, malnutrition, low immunization coverage, and environmental factors. Current child mortality rate, that's under 5 mortality, India is 32 per thousand as per 2018 SRS bulletin. Maternal mortality rate, number of maternal deaths per year per 1 lakh women aged between 15 to 49 years of age. As the reproductive age of a woman is 15 to 49 years of age. It accounts for the greatest number of deaths among women of reproductive age in developing countries. Death of a woman during pregnancy or within 42 days of termination of pregnancy, irrespective of age duration and site of pregnancy, from any cause related to or aggravated by the pregnancy. Major causes of maternal mortality are direct causes and indirect causes. Among direct causes, there is severe bleeding or hemorrhage, infection, unsafe abortions, eclampsia, obstructed labor, and among indirect causes are like infectious diseases like malaria, anemia, HIV/AIDS, cardiovascular disease. Either they complicate the pregnancy or are aggravated by it. One more is maternal mortality ratio, that is number of deaths of a woman from pregnancy related causes per 1 lakh live births. The MMR is used as a measure of quality of healthcare system. Current MMR in India is 122 per lakh live births as per 2018 SRS bulletin. Or mortality indicators. These are disease specific death rate, mortality rate, which is computed for a specific disease. For example, tuberculosis mortality is 23 per 1 lakh population per year. Or the proportional mortality rate, that's proportion of all deaths attributed to specific disease. Example, coronary heart disease, this causes 25 to 30% of all deaths in developed countries. Morbidity indicators, they revealing the burden of ill health in a community but do not measure the subclinical or hidden disease states. For example, incidence, the number of new events or new cases of a disease in a defined population within a specific period of time. Example, incidence of tuberculosis is 199 per 1 lakh population per year. Or prevalence, the total number of all individuals who have disease at a particular time divided by the population at risk of having disease at this point of time. That reflects the chronicity of a disease. Example, prevalence of tuberculosis sputum positive in a population is 277 per 1 lakh population. Notification rates is calculated from the reporting to the public authorities of certain diseases. For example, malaria, poliomyelitis, cholera, plague, etc. They provide information regarding geographic clustering of infections, quality of reporting system, attendance rates at health center, admission, readmission and discharge rate, duration of stay in hospital reflects the virulence and resistance developed by the etiological factor. Absence from work or school that reflects economic loss to the community. Hospital data they constitute a basic and primary source of information about disease prevalent in the community. Disability indicators for a Sullivan indicator refers to the expectation life free of disability. Hale health adjusted life expectancy is based on life expectancy at birth but includes adjustment for time spent in poor health. It is the equivalent number of years in full health that a newborn can expect to live based on current rates of ill health and mortality. DALYs or disability adjusted life years, a comprehensive indicator that includes both losses of health years due to disability and premature death. Two things needed to measure DALYs are life table of that country to measure the losses from premature death and loss of healthy life years resulting for disability. But the disability may be the permanent, for example, in polio, or temporary, for example, in TB, depressive, physical, and mental. Are the uses of values? It is used to assist in selecting health service priorities, to identify the disadvantaged groups, targeting health interventions, measuring the results of health interventions, providing comparable measure for planning and evaluating programs, compare the health status of different countries. One daily is one lost year of healthy life. Disability rates, that's premature death defined as one that occurs before the age to which a dying person would have expected to survive if he or she was a member of standardized mode population with a life expectancy at birth equal to that of the world's longest surviving population, that is Japan. Kylie quality adjusted life year is the most commonly used to measure the cost effectiveness of health interventions. It estimates the number of years of life added by a successful treatment or adjustment for a quality of life. Now the nutritional indicator. Nutrition indicator status is a positive health indicator. For example, newborns are measured for their birth weight, birth length, and head circumferences. They reflect the maternal nutritional status. Preschool children are measured, for example, weight, it measures acute malnutrition, height measures chronic malnutrition, mid-arm circumference measures chronic malnutrition. Growth monitoring of children is weight for age, weight for height, head and chest circumferences, mid upper arm circumference. That's mid MUAC grading is normal is more than 12.5 centimeters, moderate is 12.5 to 11.5 centimeters, severe is less than 11.5 centimeters. Adult, Adults are measured by body mass index. It's an indicator of underweight and obesity. Underweight, obesity, and anemia, they are generally considered reliable nutritional indicators. Healthcare delivery indicator. These indicators reflect the equity of distribution of health resources in different parts of country and of the provision of healthcare. For example, population per physician in India is 1 is to 1,340, population bed ratio 1 is to 1,300, population per nurse 1 is to 170, population per pharmacist is 1 is to 59. Utilization rate is expressed as the proportion of people in a need of service who actually receive it in a given period, usually a year. It depends on availability and accessibility of health services and attitude of an individual towards healthcare system. Proportion of infants who are fully immunized, proportion of pregnant women who receive ANC care and have institutional deliveries, percentage of population who adopt family planning, bed occupancy ratio, bed turnover ratio, etc. Indicators of social and mental health. These are for example, rates of suicide, homicide, other crimes, road traffic accidents, juvenile delinquency, alcohol and substance abuse, domestic violence, etc. These indicators they provide a guide to social action for improving the health of people. Social and mental health of a children depends on their parents. For example, substance abuse in orphan children, smoking in a children whose father is smoker. Environmental indicators. These reflect the quality of physical and biological environment in which disease occur and people live. The most important are those measuring the proportion of population having access to safe drinking water and sanitation facilities. These indicators they explain the prevalence of communicable disease in a community. The other indicators are those measuring the pollution of air and water, radiation, noise pollution, exposure to toxic substances in food and water. Socio-economic indicators, these do not directly measure health but are important in interpreting health indicators. Per capita income, gross domestic product, level of unemployment, illiteracy rate, poverty, population of country, total fertility rate, family size, population increase rate, contraceptive use, policy indicators. The single most important indicator of political commitment is allocation of adequate resources. The relevant indicators are proportion of GDP spent on health services, proportion of GDP spent on health related activities like water supply and sanitation and housing and nutrition, proportion of total health resources devoted to primary health care. Quality of life. In the arena of healthcare, quality of health is multidimensional concept that includes domains related to emotional, physical, mental, and social function. Quality of life is determined by the factors like health, happiness, education, social, and intel, intellectual, intellectual attainments, freedom of action, justice, and freedom of expression. Indicators of quality of life. These are physical quality of life index. It consolidates infant mortality, life expectancy at age of 1 year, and literacy. For each component, the performance of individual country is placed on a scale of 1 to 100. The composite index is calculated by averaging the three indicators giving equal weight to each. Indicators of quality of life are human development indexes. For example, life expectancy at birth, literacy rate, income, GDP per capita income. The result is placed on the table from 0 to 1 scale. Other indicators of health are, for example, social indicators, population, families, education, earnings, basic need indicators, calories consumption, access to water, illiteracy, doctor population. Thank you.